All right, we're gonna start with a couple things that I think are really kind of a foundational for the work that we do in Body Ready Method. So feel free to stop the video, practice some of the things that I'm gonna show you, or stop the video halfway and just kind of work on those things for a week or so, and then come back to the video and add to it. So it's kind of we're gonna build off of this first couple things. So the first thing I want to talk about is our breathing. So excuse me. I think a lot of us are taught that we breathe in our belly. We should be belly breathing, and although we don't necessarily not want to use our belly for breathing, we want to think of another way of breathing that's a little bit better for creating space in our rib cage and in our upper body, having strength in our core. So a lot of us are either belly breathers or chest breathers. We kind of fill up our chest and we lift our shoulders like that. So we're going to kind of go in between. We're not going to say don't move your belly. We're going to use our rib cage. So in pregnancy, this bottom part of our ribs, this part actually expands as our uterus grows up higher. And so we want to have nice mobility in our ribs, so that allows those ribs to expand a little bit in the lower part of your rib cage. If we have restriction here, or restriction meaning less mobility, or even like clothing, tight bras can restrict that movement in our chest, and which is going to cause the top of the uterus to have less space to grow. It can even cause less space for baby to navigate. And when it comes to breathing and our core, that's going to limit how our diaphragm works as well. So that's kind of the reason why we work on our breathing. And the type of breathing that I'm going to show you is called 3D breathing. And so you want to find a nice, comfortable place. We want our pelvis to be kind of neutral. So I'm sitting on a little block, or you can use a bolster, or you can sit at the edge of your seat. So we're not sitting tucked under on our tailbone, like our couches usually do, or when we sit in our car seats, we're kind of tucking under our pelvis. So a nice neutral pelvis, and we want to relax our upper body. I am a big rib thruster, so I am learning to relax and bring my shoulders down. We're kind of, our society teaches us that good posture is shoulders up and back, and then we get that nice, rotate, a nice tall straight back, and that's what we're taught is a good posture. But then we're kind of holding this super extended position, and we're stretching our abs, and it's hard to keep our pelvis neutral. It makes us want to kind of stick out our pelvis more, and it's really uncomfortable. That's really to sit like this. And so we want to actually relax the ribs. We don't want to bring forward our shoulders so much, but they can be relaxed, and they don't have to create this super flat back. So, and if any of that part is tricky, we can go into further about helping you find those positions. If you're having a hard time finding neutral pelvis or relaxing your upper body, we can do some things to kind of open up those muscles. And sometimes we have really tight muscles, and so it's hard to just relax. So going forward with the breathing, we want to just take a couple deep breaths and just feel what's happening in your own body. So when I take deep breaths, think about like when the doctor is saying, take a deep breath, and you're like, and you're having a lot of upper body movement. We want to shift that movement into our lower ribs. So imagine that all around your rib cage is expanding out, and that's where we're filling up our lungs. our belly is going to be in part of that, but it's not so much a like that or a where you're pushing out your belly and pushing it in. So now we're going to take some deep breaths into our bottom of our rib cage. And if you have your hands here, you can feel all around just kind of a slight expansion. Another way to really to feel that is just to wrap a scarf around the lower, like right under your bust, and just think about pushing out that scarf in all directions and keeping, again, your shoulders nice and relaxed. And you don't have to take these humongous breaths. You just take some deep, normal breathing too. And it can take some getting used to, because I know I tend to, when I'm thinking about not using my shoulders, then I'm tending to really drive with my belly. But we want to try it and really drive, opening the rib cage. So the way that I practice this is I kind of just check in with myself throughout the day. Maybe I'm driving, maybe I'm taking a quiet moment, I sat down, or even I'm standing in the kitchen, or standing and looking in the mirror, or whatever you happen to be doing, just kind of checking in and seeing what you're doing. Are you holding your ribs up? Are you holding your shoulders up? Kind of relax that down. Take some breaths and feel it in your rib cage. And maybe do it for 5 minutes, 3 minutes. Give yourself a little piece during the day. It can be when you're driving, when you're falling asleep. Maybe you're just working at the computer and you're just kind of trying to intentionally breathe into your rib cage. It gets easier. Sometimes now I don't have to stop and find that like stillness in my body, but I can kind of do it as maybe I'm walking, or maybe even as you get more experienced, you can continue doing it as you're, folding laundry and doing some activities. And we want it to become easier to do that, and ideally, that's how you should always breathe. But that's not always, realistic just to completely change that overnight. So we just make little goals. Check in with yourself throughout the day. And when you feel comfortable with that, or maybe you feel like, oh yeah, I feel that, I can do that, I want you to add on what we call candles or up arrows. So we're going to practice that breathing, and now we're going to practice engaging our core. And to do that, we're going to use our 3D breath and our up arrows or our candles. And the reason why we call it candles is we're going to take in that nice deep breath, and we're going to imagine that we're blowing out 100 candles on a birthday cake. And so it's strong and it's long, and we're going to activate our core. A lot of times when we activate our core, we tend to bulge our bellies, or we bulge our pelvic floor, or we're bracing and we're really using not our core but more the pressure of the air in our when we take those belly breaths, and we have that pressure down in our belly, and then we're going to use that to like lift up something heavy, that pressure of have you ever picked up something heavy and gone like that, or picked up your toddler, you kind of hold your breath and you brace yourself. So that's not really using your core. So we want to strengthen our core. Even in pregnancy, we can strengthen our core, not just maintain what we have, but we can actually strengthen it. So as we take in our deep breath and fill our bottom of our lungs, we're going to blow out our candles, and the movement is going to come from our core. So we're just going to imagine our core kind of coming in and up. So it's going to kind of look like this. Now you probably couldn't see much, but try that. Just try that kind of strong blowing out the candles, and feel what's happening in your stomach, in your pelvic floor. Do you feel your pelvic floor kind of bulging down? Maybe you don't feel it Sometimes people can sit on a ball or even place their hand on their pelvic floor and feel that bulging down. Maybe when you push out, you're using your kind of your gut like that, and it's more of that belly. Um, if that's the case, I want you to try again and really think about your deep core coming kind of up and back, up and back. So do that a couple times. Go ahead and pause the video, try it a couple times. So what I'm feeling is I'm feeling that behind my belly. I'm feeling that deep core squeezing up and back. And you might notice it, you might not, and that's okay either way. But your pelvic floor, if you're doing that, engaging your core correctly, your pelvic floor will naturally come up along for the ride. You're not doing a Kegel or you're not trying to muscle up your pelvic floor, but it comes along for the ride. So that's kind of an indicator of like, oh yeah, I'm engaging my pelvic floor. And so you're doing two things here. You're strengthening your core, which we want to do, and we are telling our pelvic floor to be responsive. So we're saying you can be relaxed. You don't have to be tight, or you don't have to be in one position. We want our pelvic floor to know that we can be relaxed, long, and come along for the ride. So practice that. When you've maybe practiced that, in a position like this, you're sitting or you're laying down, and try different positions. Maybe the sitting, you're not feeling that. Maybe lying down, you'll feel it differently. Maybe sitting on a ball, maybe standing even. So kind of play around with what position you're doing that. And again, you can stop this video now and just start with those things. I'm gonna keep going with that. The next thing I want to show you is called a hip hinge. I'm going to kind of move my camera over here. So we talked about having that neutral pelvis. One way to check how your neutral pelvis is, again, our upper body needs to be relaxed down. If we're really raising our chest, it makes our lower back arch and our pelvis kind of tilt back. If we spend a lot of time sitting in a chair, kind of tucked under in our pelvis, we can have more of a tucked pelvis. Maybe maybe your feet point out. If your feet are pointing out, that's going to give you a tucked pelvis where your tailbone is kind of curving under. So straightening out your feet and finding a neutral pelvis. Okay. So once you kind of feel comfortable with that neutral pelvis, your feet are straight forward, they're kind of hip length apart. And all we're going to do is we're going to bend at the hips. So we're going to hinge at the hips. And you're going to feel that in your hamstrings, maybe your glutes. And don't go till it's like uncomfortable, but just find kind of where your limit is. Now, this is something you can practice on its own, just like that. Maybe you do a few, when maybe you stand up and stretch a little bit, and you're like, okay, let's just do some hip hinges. It kind of feels good on your low back. Finding that neutral pelvis and kind of stretching a little bit. I like to incorporate this into your kind of daily movement patterns. So maybe brushing your teeth, you lean over to get some water, you hip hinge and you get your water, you brush your teeth. You're picking up things off the floor, which is a little bit farther than a hip hinge, but you're gonna start with a hip hinge and then, bend your knees to get what you need to go. Instead of just kind of collapsing, and kind of that arched back and holding your breath and so forth. So again, just try to incorporate it into your everyday movements. And that's what it's for, is to optimize kind of our daily movement patterns. So we're going to hip hinge. And, there's no amount that you need to do it so many times a day, or, not trying to make you carve out a certain amount of time every day for this stuff. Maybe that's something that you do anyway. And then you could just kind of add it into your stretches or exercises then that way. Moving forward from the hip hinge, we're going to use that candles and breathing along with our hip hinge. So if you're like me, I tend to hold my breath when I pick up heavy things, or I bend over, or I really hate doing laundry because I found that my laundry is low and I have to bend over and I'm kind of holding my breath and I'm getting the clothes out of the washing machine and putting it in the dryer. So instead of holding your breath when you do those types of activities, picking up your daughter, picking up heavy things, grocery bags or laundry or suitcases, you're gonna hip hinge, take a nice deep breath in, and as you go down and you pick up, you're gonna blow out your candles. And you're gonna pick up your object or your child or whatever it may be. And then you're gonna be using your core instead of just bracing and pushing all that extra pressure down onto your pelvic floor. So when we brace and we pick up heavy things, that's putting even more pressure on our pelvic floor, which we already have enough when your baby is growing and getting heavier and you're doing all of that normal stuff is putting pressure on your pelvic floor. So here we want to get the abs involved, the core involved to help us with that. So I kind of have to make a conscious effort. Okay, I'm gonna do my breath, bend over, hip hinge, bend my knees, and then candles. If you're unable to do that candles and pick up, it could be telling you that it's too much, that it's too big of a load. And so if you're able to scale back until you get a little bit more strength, then that's okay. I know sometimes we don't have a choice, like if our toddler needs to be picked up, we have to pick up our toddler. So kind of play with that. And again, incorporate it into your kind of daily activities, whether you're cleaning the house, you're doing groceries, shopping, or anything like that, playing outside and picking up snow even. You're bending over and using that those core muscles with those candles. That's a really good start to kind of start to feel some more strength, and we're going to build off of those things with future movements. So I'll let you get started with this much, and then I will do another video that kind of goes into some other areas of the body. But having these as our foundation, we'll kind of use that as well. Actually, the last thing I want to show you, this is a good thing. This is a good thing to add if you're having low back pain. I'm gonna need, let's see, I'll just use this. So I just have a yoga block. You can use anything that's sturdy that you can step on. You can even use a stool. Step back a little bit. And I'm gonna just step on one foot. Again, I'm gonna find that neutral pelvis. So be careful not to let that one leg that's not on the block kind of drop or sticking out the one hip. So we want our hips to be squared and neutral, holding on to something. And then we're just gonna swing this leg. Trying to keep our pelvis immobile. We don't wanna swing our pelvis. We're gonna swing this leg for a minute. So try to feel that this leg being really relaxed. The other leg's gonna get a little bit, gonna feel that burn a little bit, just standing on one leg and balancing, but just having something to hold on to will help. After the minute, you're gonna just kind of step off, and then you're gonna do the other side. You definitely want to do both sides. You'll feel it if you don't. So switching sides. Oops, that wasn't switching sides. There we go. I don't know what I was doing. Okay. Sorry, I'm not really neutral because I'm having to reach for this table. But again, we're going to swing this leg for a whole minute. I'm not doing a minute right now, I'm just kind of demonstrating. Keeping that neutral pelvis, and I definitely don't have it right now. And then step off. And what you're doing is your psoas muscle, which goes from your back here, and it goes through your pelvis to the front of your pelvis. And that essentially is your pelvic floor. It is a really, really important muscle. It holds up all your organs, and this is what baby has to come through to go through the birth canal. So if we're living our life in a tucked pelvis, sitting at a desk chair, in the car, a lot of that, if we have our feet, again, if we have our feet pointed out, I'm gonna back up, that's gonna tuck our pelvis. And that's keeping our psoas muscle in this tight, shortened position. And it's not that we can't sit at a desk chair or sit in the car or anything. It's that we want to just remind our psoas that it has lots of different positions. We want to remind it that it can be long, it can be relaxed. So if you are sitting a lot for work, taking once every hour, getting up and just kind of walking around, doing your psoas released at work or after a long car ride can really help. Doing it before any of the exercises that you do, just as a way to kind of remind your psoas to relax and be functional. And again, then we're teaching our psoas muscle that, yeah, we can be strong and tight when we need to, but we can relax and allow baby to come through when we need to. I think the longest part sometimes in labor is when we get so tense and we're trying to push our baby out, and our psoas is really tight and our pelvic floor doesn't want to yield to baby. So the more we practice that prenatally, the better it is in labor to say, yep, I know how to do that. My body is going to remember that I can be long and soft. So with those things, this will be a really good start to just incorporate it as much as you can into your daily life and in what ways that make sense. If you have any questions about how it feels or how it should happen, then give me a call or we can chat more, and then I will make another video. Sorry this video got a little long, but I hope it's helpful. And again, any feedback would be great. All right, thank you.